Good morning, everyone, and welcome to the Universal Health Coverage Forum 2017. My name is Susan Hubbard, and I'm a fellow with the Japan Center for International Exchange. On behalf of all of the organizers, I would like to thank you all for coming here for what promises to be a very full 2 days of rich discussion about our shared goal of ensuring that every person around the world has access to high-quality, essential health services without risk of financial hardship from accessing those services. When UN member states agreed to adopt the Sustainable Development Goals in 2015, they also committed to achieving universal health coverage by 2030. This forum offers us an opportunity to take stock of where we are on that journey. You will be hearing from government officials, international organizations, NGOs, academics, and other experts over the next couple of days who will share their experience and their expertise and propose ways to move forward in meeting that commitment that we all made 2 years ago. This forum brings together more than 500 people from around the world, including government delegations from 70 countries. It is hosted by the government of Japan and co-organized by the World Bank, the World Health Organization, UNICEF, UHC 2030, and the Japan International Cooperation Agency in collaboration with the Japan Center for International Exchange. After hearing from the co-organizers this morning, you will be learning more about the findings from the Global Monitoring Report and get an update on our progress toward global pandemic preparedness. Then we will have 2 rounds of breakout sessions, after which we will reconvene in this room for a plenary session on the knowledge management mechanisms that are so crucial to our ability to achieving universal health coverage in a constantly changing world. To kick off our first session, it gives me great pleasure to introduce our first keynote speaker, Katsunobu Kato, Minister of Health, Labor, and Welfare of Japan. Mr. Kato.
Honorable Ministers, distinguished guests, ladies and gentlemen, good morning. On behalf of the government of Japan and the organizers, I'd like to extend our warmest welcome to Japan at this UHC Forum 2017. Since we met at the 2015 UHC Tokyo meeting, Japan has been spearheading global effort toward UHC through the G7 Iseshima Summit, G7 COVID Health Ministers Meeting, and TICAD 6 in Nairobi, Kenya. It is an honor for me to open this UHC forum as Minister of Health, Labor, and Welfare of Japan, always a staunch advocate for UHC, both domestically and internationally. I'm pleased to note that this forum has now attracted not only health ministers, but other high-level participants, including head of state, finance ministers, and representatives from international organizations, NGOs, and private sectors. Each of us has an important role to play in our collective endeavor towards achieving UHC. People's health is a foundation of peace and life. Next year, 2018, marks the 40th anniversary of the Alma Ata Declaration, which made health for all a global agenda. Ever since, public health has been promoted in each country by mobilizing domestic resources and engaging local communities. Millennium Development Goals, MDGs, also provide effective in reducing 3 major infectious diseases, as well as infant and maternal mortality rate. At the same time, it was increasingly recognized that these disease-based measures alone were not enough to strengthen health systems as a whole, which is a critical foundation for providing a wide range of health services to all. Thus, Sustainable Development Goals, SDGs, have placed universal health coverage at its core, reaffirming the importance of robust health systems. In this context, while external donor funding has often made important contributions in development countries, each government must take ownership and lead nationwide effort to establish a health system that is financially sustainable in the long term. Also, when we look at each individual's past experiences taught us that designing the robust health financing mechanism that protects vulnerable people from financial hardship, as well as developing healthcare facilities and workforce, including doctors, to provide the necessary health services wherever people live, are critically important in achieving health for all. Therefore, UHC, which signifies a state in which all individuals and communities receive the health services they need without suffering financial hardship, is one of the most important targets to reach by 2030. As you may know, Japan achieved UHC in 1961, when it was still in the early stage of post-war economic development in its process. A strong political leadership was crucial, together with the wisdom of many experts, to expand the public health insurance scheme and nationwide deployment of medical schools, both of which were vital in achieving UHC. The Japanese public health insurance program has its root in employees' insurance of large corporations, and smaller companies gradually followed and introduced the same scheme. At that stage, the government has faced with the issue of how to cover self-employed individuals, including poorer farmers. Japan's answer to this question in 1961 was a no one left behind approach, that is to provide public health insurance to cover all remaining citizens. Also, in order to strengthen human resource development and the provision of health care at the local level, the government launched the One Prefecture, One Medical School initiative in 1973. The bold initiatives sparked major political debate in Japan. Against this background, they were approved as cabinet decisions and implemented by the government as a whole, not only in the Ministry of Health, but also the Ministry of Finance and the Ministry of Education took an active role in this process. I firmly believe that this early stage investment for UHC by the whole government were an important enabling factor in Japan's rapid economic development later on. Based on our experiences, my next point is that maintaining UHC after achieving it is a very important task as well. Japan has maintained UHC through a number of system-wide reforms and legislation, adapting to population aging and economic conditions. In this continuous reform process, the Japanese government has always been keen to learn about experience of other countries. For example, we learned from Germany, and our public health insurance and long-term care insurance for the elderly were built on their experiences. Likewise, If Japan's UHC experiences are helpful for other countries, we are more than willing to cooperate and share our successes as well as failures. I strongly hope that this forum will serve as the best platform for sharing the experiences and practice of each country. Finally, I would like to briefly introduce the overview of this forum. Today, we will first hear from leading global experts on the current status of UHC. At the breakout session, we will discuss various topics, including financing, community-based approaches, and aging policies. We will then talk about further cooperation through a variety of initiatives for promoting UHC. Tomorrow, we will invite the head of states, health and finance ministers, and the leaders of international and civil organizations for a high-level debate. We will also share each country's experience and visions, and discuss future collaboration across countries and other partners. I sincerely hope that we will have candid and fruitful discussions contributing to the health of all people in the world. Thank you very much for your attention. Thank you.
Thank you very much, Minister Kato. Next, I would like to introduce Dr. Shin Young-soo, the Regional Director for the Western Pacific region of WHO, for his keynote address.
Honorable Minister Kato, honorable ministers attending this forum, and esteemed senior leaders from partner agencies, and Dr. Yamamoto, the newly appointed WHO Assistant Director General in charge of UHC, distinguished guests, ladies and gentlemen, good morning. Ohayo gozaimasu. It is my honor to be invited to speak in this important forum. I would like to begin by summarizing why this forum is so important. Right now, at best, only half of the world population has coverage for essential health services. Hundreds of millions of people cannot access the health service they need to stay healthy and manage a chronic condition or recover from illness. This is because services are not available, or because for many people, using them causes serious financial hardship. Simply, we cannot create a more equitable world unless we deliver strong progress toward universal health coverage. We are not here today because UHC is a new idea. Its root can be found in the WHO constitutions, which says that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. UHC was also central to the Declaration of Alma Ata, rallying call of health for all, nearly 40 years ago. We gather here in Tokyo to be joined by Prime Minister Abe later in the week, and along with the WHO Director General and the World Bank President and other global leaders, because UHC has captured attention at the highest political levels. UHC is now at the center of the global development agenda. Our task is to ensure this political momentum is turned into real changes to people's lives. Today, I wanted to reflect on where we currently stand and how we can get closer to the goal of health for all. My starting point always is how can we best support countries in their effort and aspirations? What do countries most need from us? Shared aspiration is crucial, clearly, but so too is a country-specific approach to delivery. To achieve UHC, different strategies are needed in different countries based on what is already in place, available resources and capacity, and political commitment of the country. We must also monitor and learn from different experiences and build on them nationally, regionally, and globally. Across the 6 WHO regions, all regional committee, governing body, have adopted resolutions which outline pathways or strategies for the achieving UHC in the region. In the Western Pacific region, our approach is guided by our member states, and in particular, the Regional Action Framework on UHC they adopted in 2015. This framework acknowledges that UHC is more than just service coverage and financial protections. By definition, UHC is also about equity, quality, as well as efficiency and accountability, and resilience and sustainability. These are the hallmarks of high-performing health systems, the foundation for UHCs. Our framework also identifies a series of areas where action is needed to deliver on these health system attributes. For example, to assure the quality of health services, a country must have appropriate regulatory standards and competent health workers. To achieve equity, financial protection and access is critical, but so too are the strategies to reach likely to be left behind. A resilient health system is not only about investing in essential public health functions to ensure preparedness, but also about supporting community capacity to address health hazards and risks. Different countries will prioritize these actions in different ways, depending on their own circumstances and state of development. For instance, high-income countries are focusing on service delivery transformation to address the demographic and epidemiological transitions. They are also grappling with the cost containment and health equity. No single country has all of it right. Countries in economic transition, such as China and Vietnam, are strengthening regulatory systems and modernizing health workforce education and reducing out-of-pocket payment. They are also increasingly focused on service quality and the impact of rapid urbanization and industrialization. Small island countries in Pacific we are working with have hospitals full of patients with advanced stage of non-communicable disease. Without the capacity of treat in country, for instance, to perform heart surgery, this puts huge pressure on overseas treatment costs. These countries are looking anew at how primary health care services can be strengthened to better manage NCDs and reduce the need for expensive hospital care. Finally, highly decentralized countries such as the Philippines, the major task is to improve the connectivity across different levels of the health system through tools such as service delivery networks. In all of these, there are some key lessons, in particular for development partners. First, there is no one-size-fits-all approach to UHC, which will work for every country. There are no clinical trials from which the result can be copied from one setting to another. Second, Development partners must base their support on countries, not their own priorities. We must offer advice and options based on each country's situation, bringing together the best international experiences and knowledge, grounded in a clear sense of what is feasible in their countries. Finally, the long history of UHC shows us that the progress is not always linear. The path ahead will not always be easy, but the goal is clear. We are at a unique moment in history. We owe it to billions of people who cannot access the health services they need right now to get on with the job. Thank you.
Thank you, Dr. Shin. So our two keynote speakers have helped us really set the stage for the next 2 days. And so next I would like to invite the co-organizers, representatives from all of the co-organizing organizations, to come up on the stage and offer remarks. All right, thank you. So each of the co-organizers will come up and speak with you a little bit about what their organizations are doing on UHC and also their expectations for these 2 days, for this forum. So I'd like to start by introducing Tim Evans, the Senior Director of Health, Nutrition, and Population of the World Bank Group.
Thank you very much, Honorable Minister, distinguished colleagues of the dais, friends and colleagues. As the first representative of one of the organizing institutions of the UHC Forum, a very warm welcome to all of you. It's been an enormous pleasure and opportunity working together with the government of Japan and our sister multilaterals in preparing this conference over the last year, and it's great to see that after a lot of hard work, sweat equity, we've finally arrived at the official opening. Thanks are inadequate to recognize the tremendous efforts of so many people on so many fronts, but I would just like at the start to acknowledge those who've toiled in the trenches and really brought us here in such a fantastic condition. I'd like to pay special tribute to the government of Japan's leadership, recognizing its commitment to UHC. Not only has this country walked the talk on UHC, it is top of the charts when it comes to life expectancy and really an exemplar of what can be achieved when people's lives are valued equally. The leadership, however, is not limited to the domestic arena. It's really a prime prong of Japan's foreign policy. We've seen a slew of international initiatives that reflect Japan's support to UHC. But I have to say the one I'm most impressed by is the fact that Japan's leadership at the very highest level is contributing seminal knowledge pieces on UHC to the top medical journals in the world, like The Lancet. Now, Prime Minister Abe has twice graced the pages of The Lancet, and most recently, Finance Minister Aso on December 2nd wrote on the critical role of finance ministries in achieving universal health coverage. Now, when I read that piece, I was not only impressed by the content, I was struck and thought, how many other heads of state and ministers of finance have written in the leading medical journal in the world on the topic of UHC? And I think one has to say that Japan is singular in that respect. And I think that this is a reflection of not only a commitment to UHC, but a commitment to learning and sharing our experience and expertise. And hence, how lucky we are to be at this forum today. At the World Bank, UHC is our highest priority, not simply because it fulfills the right to good health, nutrition, and population services, but because it's a critical input to our overarching development goals that include eliminating extreme poverty and building shared prosperity. As Finance Minister Taro Aso says, Japan's achievement of UHC in 1961 contributed to social stability and to economic growth by helping to expand the middle class and realize a more equitable income distribution. That's a quote from The Lancet. But when we look around, despite this compelling value proposition, investments in UHC are sadly lacking or are grossly insufficient in far too many settings. The cost of inaction is stark and shocking, with billions unable to access health services and hundreds of millions impoverished annually due to healthcare expenses. Healthcare systems, rather than being a safety net, are a poverty trap. What we have is pay when you are ill systems, which exert a massive deterrent on people accessing care when needed. And those who needed hospitalization and enter hospitals are often victims of long-term stay until you pay, and then are discharged destitute. It doesn't have to be this way. The return on UHC is handsome, not only in terms of better health and nutrition, but as a prime driver of inclusive economic growth, better education outcomes for children, and more able and agile workers for the economy. However, if we look at progress over the last 15 years, as we did in the Business Unusual report that's included in your conference packet, you can identify reasons for optimism by looking at the high performers over the last 15 years. And a number of low and middle income countries, including Cambodia, Laos, Rwanda, Thailand, and Turkey, it's clear that countries have defied the odds and made remarkable progress in rapidly increasing health service coverage and financial protection. Universal health coverage, therefore, is an affordable and doable political choice to help us move from a health system that is exclusive, inequitable, and impoverishing to one that is inclusive, equitable, and enriching. And so, over the course of this inaugural day of the UHC Forum, we look forward to learning more about what others are doing to advance UHC and aligning ourselves at the World Bank with our partners to ensure that UHC is progressively and rapidly realized everywhere. Thank you very much.
All right. Thank you very much, Tim. Our next speaker is Naoko Yamamoto, the Assistant Director General for UHC and Health Systems at WHO.
Thank you. Honorable Minister Kato, Honorable Regional Director Singh, distinguished guests, ladies and gentlemen, good morning. On behalf of WHO, I appreciate your participation to this UHC Forum and welcome you all. First, I wish to thank the organizers and individuals who worked so hard to make this forum happen. This entire forum are organized on the principle that sharing plans and actions in countries will clarify how we can collectively achieve the goal set out in the SDG agenda. This is also the principle behind the establishment of UHC 2030, which brings a world coalition of partners working together to achieve UHC agenda globally and at country level. We believe UHC is achievable, but we know that it is not easy. Introducing and sustaining UHC requires our continuous effort. That is why we are here. We are going to learn each other from our experiences, including successes and failures, and we will strengthen our collaboration. Today, we are going to discuss about the challenges of retaining motivated, well-trained health workforce. We will look at innovative financing approaches, ensuring access to safe and quality medicines. Ensuring quality service delivery has also been an issue where more needs to be done. How to link community-based care to health and social services in the context of aging societies will also be addressed. We will share the progress we had made and the challenges we have to put our efforts to strengthen health systems and improving health society and health security. Ladies and gentlemen, nearly 40 years ago, the world came together to make a promise of health for all with the Declaration of Alma Mater. Next year, we will celebrate the 14th anniversary of Alma Mater as an opportunity to re-emphasize the importance of primary health care and the principle of equity and solidarity. I wish this UHC forum will be our milestone to be our roadmap toward UHC and succeed to the Alma Mater anniversary in 2018 and UN high-level meeting on UHC in 2019. I wish you all a productive UHC forum. Thank you very much.
Thank you very much. So our next speaker is Stefan Peterson, Associate Director and Chief of Health of UNICEF.
Thank you very much. Honorable Minister, Excellencies, colleagues, ladies and gentlemen, all protocol observed. Thank you to the government of Japan for hosting this important event and your leadership of UHC by example since 1961. UHC is now a song we're all singing, but we now need to put words to the music. We need to go from the what to the how. And the next few days will both inform us and inspire us to sing UHC loud and clear when we go home on Friday. But which words will we sing? Let me tell you how we sing in UNICEF. U is for universal, meaning everyone, but starting from women, children, and the disadvantaged. So please sing equity. H is for health, not for healthcare. This means we need to look beyond hospitals. We need preventive, promotive, as well as curative services. We need to break disease silos and integrate. We need not only breastfeeding, vaccines, and working antibiotics, but also clean water, good sanitation, and healthy food systems. We need frontline health workers in our communities as extended arms of strong primary health care. We need a focus on the client, not just in a last mile perspective, but in responsive first mile community health systems. We need mechanisms and even innovations for community engagement and social accountability. So please sing community health system. C, finally, is for coverage, not care. Do you remember? Coverage that prevents people from going broke, that pools and distributes costs. Coverage of services which let parents, communities, and countries invest not just in survive, but also in thrive, so that we will have healthy populations and that are also productive and can support older generations and even older ones that we are rapidly accumulating the world over. So, sing empower. So at this stage, I've summarized my key message here now in a karaoke way, if you allow me. U is for universal, H is for health, C is for coverage, and that is UHC. Equity and power to survive and thrive. UHC is built from community and up.
Thank you very much, Stefan, for your remarks and also for giving us a theme song for this forum. So next, I would like to invite Takao Toda, the Vice President for Human Security and Global Health with the Japan International Cooperation Agency.
It's kind of tough after a marvelous song by Stefan. Honorable Mr. Kato and Dr. Shin, and honorable ministers, ambassadors, and distinguished guests. I recall just 2 years ago, exactly in this hotel, I talked about the Mother and Child Health Handbook. And we shared the notion of avoidable death of babies, which amounts to more than 6 million. Now, after 2 years, it is less than 570. I'm very much proud of announcing this sort of decrease after 2 years. As many colleagues mentioned, after Alma-Ata and during the course of MDGs, the world had made enormous efforts. However, unfortunately, MDG 4.3 miserable results and unjustifiable health gap still persists. I'd like to ask you, all over here, why health for all has not been achieved with the enormous world effort? Why? And what will be? I'd like to share with you my modest notion for the answer of these very important questions. 2 things. The first one is the nature of the concept of health for all. Relativity of the understanding of health for all. The realization of UHC is a realization of justice and equity, as many more said, and the realization of dignity by the most marginalized people in the world. It's a kind of a mirage without our efforts. Even nowadays, more than 60 million avoidable deaths of under 5 children. But I have to tell you, more than 90% would have been saved if they were born in Europe, United States, or Japan. And undernutrition or malnutrition, it now starts to decrease after 7 years vacation. 1 out of 10 malnutrition in the world, while we have too much food in some rich countries. The second reason why health for all has not been achieved, that is our misunderstanding, or should I be modestly said, insufficient understanding about the nature of UHC. As Health Minister Kato rightly mentioned, it's not about medical issue. It's a social and political issues where everybody needs to work on that. 1/3 of children are not learning. 1/3 of children are not learning. They are not growing up without knowing the meaning of nutrition, sanitation, or even health, or vitamin or protein. They don't know. And they are growing up, 1/3 of children. They have no capacity to defend themselves. Without proper understanding of this miserable situation of the world, we will not achieve, I should say, we would not achieve health for all within 12 years. This is a meaningfulness of this very important forum. Japan International Cooperation Agency, that is an implementation agency. So we have been very much silent on this type of international cooperation. But we decided to change our morphologies, to be more vocal. Instead of doing projects silently on the ground in a scattered way among 140 countries for more than a half century, we decided to be here, to be vocal, to work with you. There is a reason for us. We've been very much passionate enough, and we would like to continue working with you by being talkative, not by keeping silent. The strengths of JICA have two. One is, as Minister Kato mentioned, we have very precious, fruitful experience in Japan. But secondly, we have been working very hard to connect the world in the name of triangular cooperation, South-South cooperation, and nowadays in the name of Goal 17 of SDGs. Let me continue this way. Now, there remains only 12 years. 3.5 billion people are without sufficient, satisfactory health service. Mirage or miracle, that is depend on us. Thank you.
Thank you very much, Dr. Toda. So the organizers have given us a very hefty agenda for the next 2 days, but I'm very confident that we can, given the people we have here in the room today, that we can achieve that going forward. So before we move on to the next session, I would like to introduce David Beasley, the Executive Director of the World Food Program, and ask him to make some remarks.
Kohler leaned over and said, "Well, he's saying, are you going to dance?" I don't know if I can dance, but I will definitely speak for a few minutes. And he woke everybody up. So, Stephen, thank you, and it's great to be here. The Sustainable Development Goals by 2030 are unrealistic in the present moment in the state of affairs, quite frankly. 19 countries in protracted conflict, wars in Syria and South Sudan, Yemen, Iraq, and the list goes on, that are distracting billions and billions of dollars that should be used for health and food and schools and nutrition. And the World Food Program, working with many of you, UNICEF and WHO, whether it's in a battlefield in Yemen or whether it's Ebola in Western Africa, we are prepared in many different ways. We spend over $6 billion in health care. Why? Because we clearly understand when people do not have the nutrition they need, they're more vulnerable to disease. My background in study, quite surprising to almost everybody I meet, is microbiology. So I understand infectious disease and what happens when the immunological system is weakened. and proper nutrition in food is critical as an elementary understanding of quality health care. But in the world today, for the first time in decades, though the population has gone from 5.3 billion to 7.5 billion, the number of people that have reduced in hunger has gone literally down several hundred million people to 777 million until the last year, that is now going up for the first time in many, many years. And the question you must ask is why? And the answer is man-made conflict. Until we end these wars, we will never address the sustainable development goals that are in our reach. We must end these wars. And the leaders in the world must come together to end the conflict. But notwithstanding that, as I tell the leaders, if you're not going to end the wars, then provide the funds that we need for quality health, nutrition, the food to feed starving people. Out of the 815 million people that go to bed hungry every night, up from 777 million, 109 million of them around the world are on the brink of starvation. In the World Food Program, we're reaching about 80 to 82 million, and out of that, many of them are receiving half rations. We know the stunting rate in war zones. Out of the 155 million children in the world that are stunted today, 75% of them are in war zones. Man-made conflict, 122 million. 82% of our expenditures today are in war zones. Man-made conflict. As I meet with leaders that are not in war zones, I ask them, I beg them to apply any and all pressure they can to end these conflicts so that we can make money available for sustainable development and better health care and better food and stronger schools, which means stronger communities. But here's what's interesting today. We now see as ISIS is moving out of Syria and joining forces with Boko Haram and Al-Shabaab and Al-Qaeda in the Sahel, for example, guess what? They're using health benefits where they can and food as a method of recruitment. Why? Because they want to infiltrate, destabilize, and then migrate and further destabilize the world. I'm getting 1 minute, and I got 10 more minutes to say. But it's an honor to be here. The World Food Program, we're not just about emergency coverage. Whether it's working with UNICEF and WHO like I have with Tony and Tedros as we went together. And I talked with Jim Kim just a couple of days ago and Antonio Guterres. We were texting each other and we said, I'll see you there. And then I realized I'm leaving tonight. They're flying in tonight. And I said, well, maybe I'll see you at the airport. But the point is, the leadership, we're committed to working together. It's critical. Whether sustainability or resilience from the World Food Program, or whether it's emergency conditions and pandemic supply chain logistics, whether it's in an Ebola territory, we are prepared to deliver what's necessary from equipment to personnel. Just in Ebola, we actually, I think we transported 19,000 humanitarian officials, staff, et cetera, into the area. We're about building facilities to deal with watery diarrhea and cholera in Yemen, working with UNICEF and WHO. And I could go on, but I don't want the bell to ring on me. And I certainly can't sing, but I am going to sing with this choir up here about the need for a healthier world. And if you and I will continue to sing together, when you consider the fact that there's $300 trillion of fluid wealth in the world today, it's inexcusable that any child in the world should go to bed hungry and not healthy and not have the health care coverage they deserve. Thank you very much.
All right, thank you very much. So I'd like to ask you all to help me thank all of our panelists and co-organizers today for very provocative and very inspiring comments. Thank you.